Hi, I'm Dr. Jeff Schels with Advanced Chiropractic, and today I wanted to go over the anatomy of the spine. So when we look at the spine, it's made up of bones that are called vertebrae. And in the lower part of the spine, there's the area called the lumbar region, and then the mid-back between the shoulder blades is called the thoracic, and then the neck is called the cervical. So when you look at the spine from the back, it should be straight. And when you look at it from the side, it should have these three curves, especially the one up in the neck like this, okay? And so right here, this is your pelvis and this is your skull. And so when we look at it, the spine really performs a couple jobs in the body. The first thing it does is it supports us and it keeps us upright. And the way that it does that is reflected in what's called our posture. So let's say when you look at the spine, and this would be just like this. Let's say that a person had where a shoulder was shifted down like this. You know, many times when we look at the x-ray, what it'll show is that there will be a leaning in the middle part of the spine to that side, which draws that shoulder down. So instead of the spine being straight, it'll have a shift. And then from the side, whenever we have these three curves, it's not uncommon for people to have where over time they have some type of an alignment issue to where their head starts to shift forward. That's called forward head posture. And when we look at the x-ray, the most common cause of that is a loss of the curve in the neck and an increased curve in the upper back. So over time, as a person starts to, have these misaligned areas of their spine, and then with the effects of gravity, it's literally will start to collapse a person's spine over time. And so that's the shape. It should be straight from the back, curved from the side. So let's say that a patient comes to our office, and it's not uncommon that we do the exam, we take the x-rays, and what we find is that they have some type of an alignment issue. Maybe it's shifting off this way, but then from the side, there's a reduced curve in the neck. And when we look at it, we see that those areas that are not lined up, we call those subluxations, the areas that are not lined up, if they're not lined up long enough, then they will start to form some degenerative changes in those areas. And you can see it right on the x-rays. It's almost like if the wheels of your car are not lined up, then the tires start to wear out. So when we see that a lot of these problems that we see with the spine have been there for many, many, many years. And a lot of times, if a person waits too long, then the problem is not fixable. However, if you can catch it early enough where it first starts to shift out of alignment, and that can happen suddenly, like in the case of a car accident, or it can happen over the course of time. But if you catch it early enough, you can change that shape and bring the spine back to the center, flatten that curve out, get more of a curve in the neck. And when we do that, not only do we see where a patient's symptoms get better over time, but we also see that you can actually change that alignment over a period of time. So if you have postural issues, you look in the mirror and one shoulder's low, or you feel like your head is going forward over time, and would like to find out if there's something that is a non-drug, non-surgical approach to fixing that problem, then I would encourage you to give us a call at 778-2225, and we'd be happy to check your spine. Thanks, have a great day.